Today by Oyinloye and the Bermuda Hospital's Board Chief of Staff, Dr. Wesley Miller. We will begin with remarks from the Minister of Health. Minister?
Good afternoon, everyone. As we head into the festive holiday season, we are reminding the public to take precautions to avoid catching the flu, coronavirus, or RSV, and other respiratory viruses that are prevalent during the colder weather. We all want to enjoy this holiday season free and clear of any illnesses, and we especially do not want to catch and spread COVID. However, unfortunately, COVID is still out there in our community. I can advise that there is currently an increase in respiratory viruses and COVID-19 infections on the islands. Our hospital is also experiencing an increase in patients visiting the ER and being admitted with respiratory illnesses, and sadly, we have quite a few of our nursing homes currently with COVID outbreaks as well. This is especially worrying. These are vulnerable people. Anyone visiting our care homes should wear a mask and take an antigen test. If a care home asks you to wear a mask and take a COVID test, you must wear the mask and take the test, whether you are a visitor or a service provider. All businesses in Bermuda are allowed to set their own policies for people who enter their premises. And yes, this can include the wearing of a mask and the taking of an antigen test. During this festive period, mask wearing is strongly recommended. Masks have been proven to help reduce the transmission of several respiratory viruses. I strongly encourage everyone to wear a mask in indoor public spaces and remember to avoid the 3 C's: close contact, crowded spaces, and confined places with poor ventilation. The 3 C's are especially important if you live in a high-risk household with people who have pre-existing conditions such as diabetes, lung disease, heart disease, or anyone who is immune compromised. Our vulnerable community also includes patients undergoing cancer treatment. Anyone who suspects that they are positive for the coronavirus or who has been a close contact should get tested. Numerous pharmacies offer COVID testing in addition to the home test kits that can be purchased off the shelf. By law, you must isolate immediately if you test positive on a COVID test, whether or not it was self-administered or a verified or supervised antigen or a PCR test. If you test positive, you must adhere to the following guidance. Whether you are fully immunized or not, you must isolate for 5 days from the first day of COVID-19 symptoms or the day of your positive test sample, even if you have no symptoms. And the date of your positive test sample or the onset of symptoms counts as day 0. If at day 5 you have had no symptoms for the last 2 days, you take a supervised or self-administered antigen test. If you still have no symptoms and the day 5 test is negative, stay isolated and take a supervised or self-administered antigen test on day 6. If you have no symptoms and the day 6 test is negative, you can end isolation and continue to follow the public health guidance. If you do have symptoms at day 5, stay isolated until day 7. And if at day 7 you have had no symptoms for 2 days, take a supervised or self-administered antigen test on day 7. And if you have no symptoms, and the day 7 test is negative, you end isolation and again follow the public health guidance. If at day 7 you continue to have symptoms or test positive, you must stay isolated until you do not have any symptoms for at least 2 days and have 1 negative supervised or self-administered antigen test. And if you continue to have symptoms and test positive for COVID-19 up until day 14, you should seek your doctor who will advise you when to end isolation. And all of this guidance can be found at guidance on gov.bm. Please remember that as we continue to live safely with COVID, vaccination remains the best way to fight the coronavirus. The Pfizer BioNTech or original adult formulation and Moderna bivalent vaccine and boosters are available through participating GP offices, pharmacies, and pediatricians. And we are grateful for the collective efforts of our local pharmacies, GPs, pediatricians, the Bermuda Diabetes Center, and the St. John's Ambulance Brigade, who have been administering these vaccines. I strongly urge all eligible individuals to get the coronavirus vaccination and get boosted on time. Contact your GP or a participating pharmacy to make an appointment. Vaccines are offered to Bermuda residents who meet the following criteria. Children between the ages of 5 and 11 are eligible for the first or second dose only, and the time between doses must be at least 21 days. Persons 12 and above are eligible for the first, second, or third dose, and the time between the first and second dose must be at least 21 days, and the time between the second dose and the third dose booster must be at least 5 months. Residents 50 years of age or older and immunocompromised residents of any age are eligible for a fourth dose and subsequent doses, provided that their last dose was at least 5 months ago. And health and essential workers of any age are eligible for a fourth dose and subsequent doses, provided that their last dose was at least 5 months ago. And again, this information can be obtained on the gov.bm website. Before I end, I also want to remind businesses again that they can set their own COVID policy for their staff, their customers, their service providers, and any member of the public attending their premises. I'm asking everyone to be aware that if a business requires a COVID test and or mask, then that is their right to do so, and it must be done. During the holidays, be mindful of the risks that you are taking when you are attending parties, dinners, and events. None of us wants to be sick during the holidays. Take appropriate safety measures to protect yourself, your loved ones, and our vulnerable community, seniors, and those who are immune compromised. I wish everyone a joyful and safe holiday season, and please, Bermuda, to remember to be safe. Thank you.
Thank you, Minister. Dr. Ayo?
Good afternoon, Bermuda. I will be sharing a couple of slides with you, and before I start, excuse me, I'd like to wish everybody happy holidays. Okay, I hope I'm sharing the right screen. Can you see my screen?
Yes, we can see it, Dr. Ayo, thanks.
Thank you. Okay, thank you. Right. So today we're going to be talking about expanding a little bit on the minister's statement and showing some of the data behind that. Hopefully most people will be familiar with the epidemic curve of how our infections have been going so far. You will notice that we've never really dropped down in terms of number of positive confirmed cases. However, since the change in the regulations and the quarantine order, the number of mandatory testing has gone down significantly, and therefore we are not seeing as many cases as we saw earlier on. But it's important to point out that this is only the tip of only a fraction of the cases that we are seeing at this point because of the changes in our legislation. Now, as of this week, the active cases that we are aware about, this is cases that have been reported to us, shows that we're having a lot more problems with our older, vulnerable members of the population. What this means is that this is just a tip of the iceberg of what's going on in the community. We have 7 long-term care facilities in outbreak since the beginning of the month of December. This involves about 32 staff and residents. And some of these residents have sadly ended up in hospital. These outbreaks are incredibly disruptive to the care settings. They result in prolonged isolation with the attendant mental health stress that places on residents. And it also impedes on the staffing arrangements in these facilities. It's very disruptive. So the hospital admissions for COVID-19, as you've heard the minister talk about, since the beginning of October till now, and this coincides with the period where we have had the booster vaccinations available for use. We've had 25 admissions since then into hospital. The mean age of the people admitted has been on the higher side, so it's 76 years, and most people are over 60. The percentage of those who are not vaccinated and boosted who ended up in hospital is 96%. The mean time since the last vaccination time for those who have been vaccinated was just less than a year. And more than half of those who've ended up in hospital actually did not have any evidence of any vaccination at all. So from our data, this is not data from elsewhere, this is local data to Bermuda. The risk of hospitalization if you have not been vaccinated and boosted is 8 times more than if you've had a vaccine and you've been boosted or on island. So this is something I would like you to remember. And this is particularly important because of the pressures that this is putting on our hospital. And as I'm sure Dr. Miller will describe later on. So what can we do about this? We have, as the minister pointed out, there are actions that we can take as individuals to protect ourselves around getting vaccinated and getting boosted, and also taking the non-pharmacological measures like washing our hands, maintaining social distance, keeping ensuring that we're staying in well-ventilated places, and avoiding the 3 C's. In addition to this, vulnerable people who have medical vulnerability as a result of their age and other medical vulnerability should, in particular, get vaccinated with the booster dose in this winter. It's extremely important because, as I pointed out and shown earlier on, you are much less likely to end up in hospital if you have been boosted. In addition to that, regardless of your vaccination status, if you are symptomatic, that you have any symptoms suggestive of COVID, and I'm sure everybody's aware of all those symptoms by now, I will strongly advise you, especially if you have a medical vulnerability as a result of age or long-term conditions, to test early because we now have oral antiviral medications that you can use, but those oral antivirals are only effective if used within 5 days of your symptom onset. So if you are medically vulnerable and you have symptoms of COVID, do test early and speak to your doctor early. Your doctor will be able to prescribe you, if appropriate, any of these oral antivirals. That would significantly reduce your risk of ending up in hospital or death and shorten the time of your illness. It's extremely important that we do this and protect the hospitals against the pressures that they're facing this winter. Thank you very much, Bermuda, and I wish everybody safe and enjoyable holidays.
Thank you. Thank you very much, Dr. Ayo. And now we will hear from Dr. Miller. Dr. Miller?
Thank you very much, Ms. Adams, and I must say thanks to Dr. Ayo and the minister, and I echo the sentiments and the statements from them. Here at the hospital, we greatly appreciate the work being done by the Ministry of Health and the Public Health Service in helping to keep the hospital in a position where we can continue to run without being overburdened. We anticipate and we plan for every winter that we will have increased admissions. Having said that, there are consequences that come with it. We have to reduce the amount of elective surgery, which we do, so as to make sure that we have more beds available in anticipation of the admissions that usually come with the flu season. We anticipate that this year the flu season may well be worse than previous years, based on what we have seen in Australia and also on the East Coast in the United States. We therefore join in encouraging people to have both their COVID vaccine and the flu vaccine, and to emphasize that it is possible to have both on the same day, and indeed it is quite safe to do so. We don't suggest for one moment that everybody who gets the flu vaccine will not get the flu. However, we do know that it does offer some protection to the extent that even those who get the flu, if they've had the vaccine, is more likely to be less severe, and therefore the chance of ending up in the hospital is much less. In relation to COVID, the figures, which are Bermuda figures, we must emphasize, which Dr. Ayo has just shown, make it abundantly clear that those who are adequately vaccinated will have a much lower risk of ending up in hospital. In fact, those who are vaccinated versus those who are not, it's a ratio of 8 times different. So that's very significant, no question about it. And so I would like to encourage the public, and particularly those who are vulnerable, and we notice it particularly in the over 50s, and it begins to get into much bigger numbers once we get over 60, that they should have their immunization. And therefore would ask people who have elderly relatives at home or those in the nursing home to encourage them to have their immunization. Here at BHB, we also have a number of elderly folks, and I would ask their relatives to encourage them to have the appropriate flu and the COVID vaccine. While it is not compulsory, it is strongly encouraged for the benefit and safety of everyone. And if we can do that, we will hopefully keep things running. We want to be in a position where we can treat those individuals who will have all the other attendant illnesses. After all, there will be strokes, there will be heart attacks, there will be appendicitis, ectopic pregnancies, all the many things that normally occur. And we don't have vaccines for those. But for the flu and for COVID, we're in a position to prevent a lot of that, and I would urge the public to do so. In terms of hospital beds, I would also like to take the opportunity to ask those individuals who have friends or relatives who are fit for discharge to take them home as soon as is possible, not only so that they will have a wonderful Christmas at home, but it will allow others to have the benefit of being treated in the facility and for us to provide a bed if necessary. So we greatly appreciate that. And as we get to the end of the year, I would like to take the opportunity to thank our staff throughout the entire BHB, and also thank the public for the cooperation that they have given. Whereas we think in terms many times of just the physical illnesses, which we will see here at King Edward, we must also bear in mind that at our MWI campus, we also have some people who are there long-term and who ordinarily could be discharged, and therefore use this opportunity to appeal to relatives to consider taking them home and let them enjoy Christmas with you. In addition to that too, at MWI, we do know that we will see people who the stresses of life and the stress, particularly around Christmas time, may mean that there will be acute episodes that they will have to attend for treatment. Our facility will be open, we will be there and attentive, and you can attend, or people can simply call, because we also have the facility that you can call where assistance is required. So thank you very much, and thanks to Dr. Ayo and the minister in particular for the wonderful help that they have given over the years of COVID and continue to give, so that BHB can continue to offer the services that we are mandated to offer. Thanks a lot.
Thank you, Dr. Miller, and thank you, Minister Dr. Ayo. We will now take questions from the media, and we'll start with Jasmine Patterson from Bermuda Broadcasting. All right, do we have Jasmine? Hello, Jasmine, we can see you.
Yes, I'm here.
Okay, great. I just wanted to, in the interest of time, just remind you, please keep your questions specific to today's topic. Thanks.
Great. Hi, good afternoon, and thank you all for your presentations this afternoon. I guess firstly, can you hear me okay?
Yes, we can hear you.
Okay. Okay, I just going back to the Blue Express that took place earlier this season. How many people were vaccinated compared to 2019 levels and perhaps the past 2 years?
Jasmine, I'm afraid I don't have that information in front of me with respect to the numbers that were vaccinated. I believe we did do a report on that when we were advertising, and so far as what our data was showing at the time, but I wouldn't have the numbers of persons that were immunized against the flu this year versus last year, not in front of me now.
Okay, thank you. I guess in terms of the level of respiratory illnesses that we're seeing and the types of illnesses, would it be accurate to state that the pandemic has perhaps had a knock-on effect on the outbreak of respiratory illnesses in Bermuda and globally?
Minister can comment there. So yeah, I think the pandemic has had a knock-on effect on every aspect of our lives, including hospital admissions this winter. So it's an unprecedented time that we've all gone through, and this we're still recovering from that. So yes, it has had an impact on all the aspects of our lives, including the winter bugs that we're seeing now.
To what extent is travelers and people visiting the island, to what extent is that sort of boosting this outbreak of respiratory illnesses?
That's an impossible question to answer because we are no longer mandating any testing for visitors, so we don't know. But it's a global village. Everybody else in the world is moving around. And by moving around, we will shed viruses. But it's important that people understand how they can protect themselves and protect their loved ones. If you take on all the advice that the minister stated about avoiding the 3 C's, then you are less likely to, even if a visitor brings it in, you're less likely to have the virus and pass it on to someone who's vulnerable and may come to harm as a result of it.
Sure. Does stopping COVID testing at the border, negatively impact the ministry's ability to track cases locally? How are you tracking local cases? Is it just through the hospital?
Well, I wouldn't say it's negatively affected us. We certainly don't know the real number of infections in the community anymore. But it's arguable whether we actually need all that information now. What we need is to understand the trends. And we know that the proportion of people who gets infected will end up in hospital. So that is a good proxy to allow us to understand what else is going on in the community. And our care homes and a few other employers have continued to test. So we do have samples that tells us what sort of strains is circulating in the population and what extra measures we need to put in place.
Would it be helpful for members of the public to submit their, testing status? Would that help you at all?
Absolutely, it would be helpful to know when people test at home with their antigen tests to inform us that they have tested positive. That gives us an idea of what's going on in the community. However, that's not scientific because we're not testing everybody. That just gives us a flavor of what's going on.
Sure.
And as I mentioned, we do have sentinel sites that still are testing, and that those provides us with the samples we need to be able to monitor what strains we're dealing with locally and if anything is changed.
Sure. If I may just add two more questions. Just how severe are the cases, those that are hospitalized? Do you expect full recovery of those patients?
I'll start. I'm sure Dr. Miller would like to add to that. So fortunately, we've not had anybody in intensive care at this point in time, so which is good news. Majority of people end up recovering fully from this, although it takes some time depending on the medical vulnerabilities. The immediate impact on us as a community is that those beds, when occupied by patients who have either flu or COVID or any of the other respiratory bugs, are beds that cannot be used when we have road traffic accidents or appendicitis or heart attacks or strokes, as Dr. Miller mentioned. So it's important for us to keep those needing to go to hospital at a minimum, so that the hospital can continue to function and provide that vital service that we all depend on.
Around how many of the hospitalizations are flu related?
I don't have those numbers at the tip of my hand. I'm sure the hospital will be able to provide that for us at some point if you ask them for it, but that's not a figure that we will be carrying around regularly.
If I could just add something real quick, Jasmine, a point that Dr. Miller said, which I think is extremely important and it warrants repetition, is that some of the admissions in the hospital with respect to persons that have flu and or COVID, those could be preventable if they were vaccinated. So if they had availed themselves of the availability of immunization that exists here on island widely, then they may have avoided being in hospital, which could then prevent, as Dr. Miller said, somebody else who has an appendicitis or some other acute condition from being admitted because the bed is occupied by somebody that could have avoided being there in the first place had they taken steps to get immunized.
Thank you. And when it comes to COVID infections, I guess I just wanted to get some clarity. Some may feel that if they've been infected with COVID, they may have a level of protection for a few months after. How soon after infection should someone be boosted to maximize their protection?
For us in Bermuda, what's required is if you don't have an active disease, we just need to make sure that you don't have an active disease, and then you're eligible for boosted. As long as for the booster vaccinations, as long as you meet the eligibility criteria. So the important thing is that you don't have an active disease at the time, and typically that's about 4 weeks after you've been infected.
Thank you all for your time and have a great holiday. Thanks.
Thank you, Jasmine.
Thank you.
And we'll take questions now from Sarah Lagan of the Royal Gazette. Hello, Sarah. We can see you.
Hello, can you hear me?
Hi. Yes, we can see you. And just want to remind
Okay,
you,
great.
please to keep your questions specific to today's topic.
Yeah, absolutely.
Oh, Sarah, can you turn your video down? We can
Yeah,
hear your
just 1
video.
second.
Thanks.
Okay, that's better.
Yes, thank you.
Okay, great. So you'd mentioned there were some outbreaks in the care setting. Can you provide any information really or detail on how severe those outbreaks were?
Yes, that in care, there are 7 care settings who are in outbreak at the moment. We have over 30 people, both staff and residents who have been infected now. Sadly, some people have ended up in hospital. It will be difficult to provide you any more specific information without divulging people's personal medical information.
Okay, and just on that same topic, you'd mentioned, this does have a strain on people's mental health, and I was wondering if there are still extra provisions in terms of the government providing help with people with suffering from mental health as a result of these outbreaks and infections.
Could you be more specific? I'm not sure what you're talking about.
Well, when the minister was mentioning that there were outbreaks in these care settings, that it's having a strain on people's mental health because of prolonged isolation and that sort of thing. And I was just wondering what services are available to them in terms of helping them with mental health issues.
Well, specific to those care homes or as across the island?
I guess to the community at large as well, because
Right,
it's
okay.
always mentioned throughout the pandemic, the help, the hotlines and things like that, whether they're all still available.
Yeah, I'm sure Dr. Miller will be able to tell us all the wonderful services our colleagues at MWI provide. Yes,
Our colleagues at MWI continue to provide services, and they're always available on a confidential basis, so they can be called throughout the time, and they will provide advice. It consists of some of our specialist nurses and our psychiatrists, so that clinical team is there and will be providing that assistance throughout the holidays. So we're not going to close it down to say, oh, it's Christmas Day, so there's nobody available to talk to, or Boxing Day, or New Year's Day, or New Year's Eve. So they can feel assured that we will have that service continuing to run 24/7, be it public holiday or not.
Okay, great, thank you. Also, there was some mention on elective surgeries. Can you give any indication on the status of the surgery backlog? You still have a backlog?
We do have, like most places, a backlog because we've had a sustained onslaught of COVID for much of the past 2 years. Notwithstanding that, we have been able to, whenever there's what we, for want of a better word, call a lull, we have been able to ramp up activity. So that, for example, and then we also had other things that we, as you know, we have implemented a new EMR. And the challenge with implementing the new EMR, we expect that, like everywhere else, things had to slow down as we move to go live because people will be learning a new system. But having said that, and notwithstanding all those challenges, one of the areas where we had a significant backlog, though much less than, say, the UK and many centers in the United States and elsewhere. So we're doing better than them, but not as good as we would like. We were able to have an overseas surgeon coming in who was able to do many hip surgeries in a week. In other words, we pushed the system to the limit in order to make that possible. We have also found ways of reducing the backlog by encouraging the local surgeons to adopt some of the more modern practices so that, for example, some of our hip and knee surgeries that hitherto may have been admitted for several days have been done as day cases like they would have been done at the Mass General or Leahy or any of the Brigham or any of the big hospitals in Boston. So in an odd way, we have taken the opportunity during that time to move into more modern practices and to be aligned with some of the best centers in the United States in terms of the way they deliver care. So by being able to do some cases, more cases as day case procedures, we were able to do things without the limitation of beds being available.
Okay, great, thank you. And just in terms of the number of patients at the hospital who are fit for discharge, how many are there?
It does vary from time to time and from one area to the next, but in any one day you may find on, say, a particular ward, and we don't want to give the exact numbers so as to breach any confidentiality, but on any particular ward, there may be 5 or 7 patients that would be otherwise fit to be discharged or have been discharged, but they continue to remain there because either no relative have picked them up or they have not identified a suitable place to go.
Okay, all right. And then just finally, you're talking about the, how the change of legislation means that there's less data really on how many numbers of active cases there are for COVID in the community. So do you have any means to come up with an estimate of how many active cases there actually are in the absence of that data?
Right, as I mentioned earlier on, we don't actually need that data. We're able to project based on what we have. So we expect a proportion of people who've tested positive to COVID to report to the hospital. And that we are able to get that information. And from that, we're able to estimate what the problem is like in the whole community. So yes, we do have good models that tell us what is going on, and it's as a result of those models that we think that there's a problem in the community now, and this is important for us to put these measures in place.
Okay, thanks very much.
Thank you, Sarah. We now have Trevor Lindsay from TNN, who will be asking some questions. We now have Trevor Lindsay from TNN. Hi, Trevor. Just have to actually turn your volume down so that we can hear you and not the recording. Also, please keep your questions specific to today's topic. Thank you.
Sure. Thank you much. Good day. Good day to all. I don't know if you can hear me. Just give me a head nod if you can.
Yes, we can hear you, Trevor. Thanks.
Minister, pardon me, Minister. I didn't catch the first part of the press conference, so I want to ask: do you have any numbers on COVID, flu, and RSV? Is RSV in our community? Because we've had a lot of young children in schools out this week due to the flu. Is there any data that indicates that we have that RSV strand here in Bermuda?
I'll yield to the CMO, but as I did say in the beginning, Trevor, because of the colder seasons that we're now in the midst of, unfortunately, flu, coronavirus, and RSV are certainly more prevalent because of that. But insofar as the actual raw data, I'm not sure if the CMO can elaborate on that.
Thank you.
Yeah, thank you, Minister. Yes, we do have some information. We don't test everyone for RSV. We only need to get trend data. And yes, we have some viral panels that have been positive for RSV. So we know that that exists. There's no added benefit to testing everybody.
Okay, thank you. I appreciate that. I've just spoken with a friend about a half an hour ago that stated that they have COVID. Are there still testing facilities? Once you've been, you do a antigen test, positive, are there testing, is it the same regimen, 10 days? Do you have a testing facility at the post office? Is that been dismantled, or what's the practice?
Yes, when we ended the public health emergency, we did discontinue the testing at PROTS, but testing is obviously widely available either through pharmacies or GP's offices, and likewise, you can purchase the testing and the testing at pharmacies, grocery stores, and the like. So we're just encouraging persons to do that. But insofar as the provision of services, testing services by the government, that has been discontinued. Yes.
Thank you, Minister. Chief Dr. Miller, you stated reference to patients at the hospital, especially the long-term patients with the ability to, they're ready to leave, but coming up on this season, what one might call granny dumping season. Are you seeing this practice increasing as we speak?
I don't have data on that at the moment, and the granny dumping, I have not been convinced that we should use that term. There are some people who I'd rather say they could behave a little better, because in the past, and I've not seen it yet or have any data, but in the past there were people who would take granny to hospital for something that was genuine, but decide that, well, since she's in hospital, we should take the opportunity to go shopping or to go off to the States. And it's really nice there. Let me spend a few extra days, and therefore did not necessarily come back to take the relative on time. It may be a week later or so. But in terms of the abandonment or the total abandonment, I've not really seen that. Now, the odd case could be happening, which I'm not aware of, but in terms of it being a large scale thing, certainly I've not seen that.
Thank you, sir. My last question to Minister of Health. If the numbers get outrageous, would you consider going back to mask mandate legislation?
Thank you, Trevor. As you can appreciate, a lot of these decisions are of the cabinet, and we discuss them on a regular basis. And certainly the issue of COVID is quite topical, and it still remains topical. So we will continue to watch this space. And if its circumstances support the requirements of further types of enhancements to ensure our public safety, then those certainly will be discussed and communicated accordingly to the members of the public.
Thank you very much. I appreciate it. Thank you. That's my questions. Merry Christmas to all.
You too.
And thank you for allowing me in.
Thank you.
Thank you, Trevor. Minister, did you want to say anything before we end it?
Yes, thank you. Again, thank you everyone for your attendance this afternoon. And I certainly want to just impress upon members of the public that we are our brother's keepers. And it's certainly necessary for us to not only do things that we can to minimize the impacts of COVID within our own personal circumstances, but also take care of our members of the community, especially those that are more vulnerable, by making sure that we adhere to the public health guidelines as well as the 3 C's, and to be safe over this particularly Christmas holiday. Thank you and good afternoon.
Thank you. And thank you, Dr. Miller and Dr. Ayer. That concludes our press conference for today.